Tanya Hubach is alive because a baby she'll never meet was born in New York. Tanya has acute lymphoblastic leukemia. She is the first person in Houston to have a bone marrow transplant using umbilical cord blood.
We estimated her chances of cure without a transplant is in the range of 10% or maybe less, and we hope that this transplant will increase her chance of overall control of the leukemia, hopefully in the range of 50% or maybe higher.
To find a bone marrow donor, Dr. Chan first searched for a match among Tanya's siblings, relatives, and finally the National Bone Marrow Registry. But Tanya was too sick to wait for an unrelated adult's bone marrow. Dr. Chan then looked for a match among 6,000 umbilical cord blood samples frozen in a New York blood bank. On March 5th, Tanya got her bone marrow transplant from the umbilical cord blood of a New York donor. The transplant will stimulate growth of a brand new blood system in Tanya. Leukemia had destroyed her original bone marrow.
And the transplant is needed very urgently because the risk of treatment failure is high, or her disease might come out of remission. Then gaining that 2 or 3 months might be very important.
Ashley Samudio is just a few weeks away from making Houston medical history. Her newborn baby sister's umbilical cord blood is the perfect material for Ashley. The 2-year-old needs a bone marrow transplant to replace her own marrow. She, too, has an acute form of childhood leukemia. Umbilical cord blood is the hottest trend in bone marrow transplant for children. Michelle Carew did not live long after her umbilical cord bone marrow transplant. Although over 200 such transplants have been performed in the United States, it's still considered unproven.
I don't know we have any confirmatory data to say that this is equally good. We're still in the process of learning.